And let's start here. We're seeing now fewer new cases in recent days, but also at the same time, some grim milestones with the U.S. surpassing 900,000 deaths and the Commonwealth of Pennsylvania exceeding 2.7 million cases since the pandemic began. Are these numbers telling you anything about the direction the pandemic is heading?
I think the most important immediate number is the decline in cases. With how transmissible the Omicron variant has been, we've seen this huge spike in cases, especially among those who are vulnerable from being unvaccinated or unboosted. Now that those infections have gone through the population, the number of cases is going down. So that's a cause for optimism. The number of cases, and most tragically, the number of deaths we've had since the beginning of the pandemic, are really something that we need to be looking to the future about. How do we prepare ourselves to be safe and to avoid these circumstances again? So I'm cautiously optimistic that in the next few weeks, we will be at a level very, very low in transmission. And the question will be for our community, how do we stay there?
Meanwhile, the CDC is revising its recommendation for immunocompromised people to get a second COVID-19 booster. So this would be a fourth shot overall, 3 months after their third shot. They previously recommended that the fourth shot come at 5 months. How do you think this change will help?
One of the things we're seeing among those who are immunocompromised is that their response to the vaccine has not been as robust as those who have more robust immune systems. And so the CDC is basically recommending this quicker booster shot to try and get the level of immunity among those who are particularly vulnerable to infection as high as possible. There's also a theory that the way that new variants are coming about is through a higher degree of circulation among those who are particularly vulnerable, including the immunocompromised. And so if we can bolster the immunity in this population, we could potentially reduce the likelihood of future variants that could cause problems in the future.
We also broke the story on Pittsburgh's Action News 4 this morning that Walgreens and CVS will end their limits on the purchase of COVID-19 testing kits. And this is happening just as people are receiving those at-home testing kits from the U.S. government in the mail. Why is it important that people have these tests in their homes, Dr. Venkat?
What we've seen with the Omicron variant is that there was such a rapid increase in the number of cases that we did not have the testing capacity for people to be able to tell whether they were infected and how they can protect themselves, their families, and their communities. With the availability of testing, both for purchase from pharmacies, like you mentioned, as well as from the federal government, moving forward, we should have in our own homes the ability to tell whether we are infected and how, from that result, we can then protect ourselves, our families, and our community. So I'm glad we're doing this. I wish it had been more rapid at the beginning of both the Delta surge and the Omicron surge. But now we have these resources, and combined with a lower number of cases, I am optimistic that we are pointing towards a brighter and safer future and hopefully our exit from the pandemic overall.
Dr. Venkat, as always, we thank you for being with us. And a reminder, if you have a question about the COVID-19 pandemic or the vaccine, please share it with us and we will get to work to get your answers. You can submit your questions on the WTAE Facebook page.